Hello. So this is my research proposal with regard to the grant writing, surviving two wars, supporting pediatric cancer treatment during genocide. So my name is Brimah-Sallu, a project submitted in complete fulfillment of the requirement of the course grant writing, and the instructor is just John W. Brissett. So for the Department of Public Health. So the project summary is a conflicted, affected, and vulnerable settings, a broad term describing a range of situations including humanitarian crisis, portrayed emergency, and armed conflict. All 36 hospitals in Gaza have been destroyed. So this project is to set up mobile healthcare oncology units in the treatment of pediatric cancer in Gaza. So the statement proposes that to establish a response unit for pediatric oncology response in genocidal conflict zone, case study Gaza, ensuring consistent research, life-saving cancer treatment, and psychosocial support for affected children. The United Nations reports that during genocidal conflict, healthcare systems are often deliberately targeted, leading to a significant gap in essential medical services, including oncology care. Children with cancer are particularly vulnerable in this setting due to weakened immune system, malnutrition, and disrupted access to medication and treatment facilities. In the study conducted by Doctors Without Borders, conflicted affected region with no specialized pediatric oncology facilities reported 50% increase in preventable cancer death among children compared to non-conflict zone. That is the citation from Doctors Without Borders 2019. So the rationale is that genocide is defined by United Nations in 1948 as a specific act committed with intent to destroy in whole or part or national, ethnic, racial, or religious group, including killing, torture, etc. So currently Gaza have lost all of their health facilities, so this is to try to set up a mobile oncology unit for kids that have been exposed to explosive weapons, which will affect them infects them with cancer. So the research design is a mixed method. We are going to use both qualitative and quantitative method of research. We are going to use both online interview and survey. So the first phase is for the first phase 1 to 3 months, we are going to do the needs assessment. Objective is to interview at least 20 pediatric cancer patients at Gaza to assess current healthcare infrastructure and specific need of pediatric cancer patients in the targeted zone. We are going to collect data, we are going to analyze and then have an input. So phase 2, the mobile unit deployment within 12 months based on need assessment. The mobile unit will be equipped with chemotherapy supplies, basic diagnostic equipment, pediatric oncology treatment protocol adapted to low resource setting. The unit will follow international standards, deployment, pilot testing, and then we'll be having the training and capacity building within 12 months, 5 to 12 months, and then phase 4, monitoring and evaluation within 6 to 18 months. And then significance, there is a gap in this type of research. Conflict affected areas in the use of mobile units to provide treatment to pediatric cancer. About 10,000 Palestinian children killed and over 1,000 children injured and under dire medical condition beyond physical harm. Children are enduring severe trauma, displacement, lack of etc. And then we have the research question. We want to know the framework and innovative approaches that can be employed to improve the outcome. How can the impact of pediatric oncology response units in genocidal conflict? What are the best practices? How can pediatric oncology response units be designed? And then the literature review I have a literature review from the brutal genocidal war from Rwanda, and also literature review from a House Bill 312 of Illinois legislation, which was sponsored by Representative John Fraser and Senator Jacqueline, was signed into law of governor. This bill expanded genocidal education of the state elementary and high school students who prior to House Bill were only required to learn about the Holocaust and Nazi atrocities of the 20th century. And then we have the budget. Small equipment accessory $8,000, supplies $6,000, travel $4,500, contractual services $5,500, other miscellaneous $4,000. So the total request is $28,000. Then we have our reference from WHO, etc. So this is my presentation for my final grants writing for final grants writing for public health. Thank you.